Welcome to the Compromise to Alchemize podcast, my conversations with some of the leading experts in the field of healing from a broad range of disciplines. Milt is, I just want to say who you are, and then you're going to tell everybody who you are. But the conversation just, really arose out of my appreciation for who you are. And as any of us parents with, kids who grow up with tongue tie, although I'm now a provider, obviously, who cares for patients that have oral restrictions and airway issues. And, we're going to get into all that, talk about our collaboration and your contribution to the field. But as a parent, I'm scouring, Facebook forums to look for resources. But now as a provider, I look at those because I want to help people. And I can't tell you how many people in the Illinois tongue tie forum have said, who do we go to for help when we need it with any of these issues with our babies or kids or older? And they say, Dr. G. So I just want you to know you are Dr. G. And anytime somebody gets their name abbreviated to one letter, you know that that's a good thing because nobody questions who they're talking about. And there's a lot of Dr. G's in the world. So, and I actually think that it's funny. I had a Dr. G that I learned from. All the people that he taught were my mentors. The Gonstead Clinic in Mount Horeb, Wisconsin, as a chiropractor. So that used to be the Dr. G that we would refer to, but you are now the current Dr. G that I refer to. So, boy, it's just a pleasure it's been amazing to get to talk to you and to get to just collaborate even on some cases, even though we're not in the same city or state. But just to kind of give everybody an idea, those of you who may not know, Dr. Geivelis is a periodontist and he's a surgeon. And so he's got so many specialties wrapped up, not just the airway one, that is part of how he got into this field. And we'll have, you share all about that and talk about that. So in a moment, I'll do that. But I just want to preface this by saying, on this Compromise to Alchemize podcast, this is the volume where I'm getting into talking with those that are guiding people in healers, and in your case, oral surgeon, dentist who is doing surgeries that are really advanced. And I'm really focusing on the myofunctional therapist and those like you who we need because, my kids all struggled with breastfeeding and for different reasons they needed frenectomies. And thank God, because it helped them, even though I did the body work and it wasn't helping complex body work that I do, and all of that. It's like that set them up so they could get an optimal release. And then post-op, I could take care of them. But I have grown to be just obviously a big fan of your contribution. So first of all, I just wanted to have you just kind of echo that and tell me, go into a little bit more of from your perspective, like tell me where you trained. I think it's at Northwestern, or at least you've done some of your postdoc. Right. Tell me where you trained and then kind of what got you into this field. And then, we can go from there.
Absolutely. First of all, thank you for inviting me and thank you for your kind words about me. Actually, yes, I'm a periodontal surgeon and I had all my education at Northwestern here in Chicago. And I got my dental degree there, and then I did my periodontal surgical training, and I also have a master's of science in immunology from Northwestern because I did research on basic science in interleukin, specifically interleukin-6, with an inflammatory protein. And that's where I started. And my career, I was from 93 until 2001, I was actually the program director of the surgical program at Northwestern, of the periodontal program, also at the hospital and in private practice. And then after 2001, I went to full-time private practice. I'm still on staff at Northwestern Medicine at the hospital. And I was, even when I was at Northwestern or even later, I was doing a lot of work on special needs kids as a surgeon, because special needs kids and adults, but especially kids, they hurt themselves a lot. They got a lot of oral health issues. So I did, in collaboration with other professionals, oral surgeons and so on and so forth, I worked a lot on special needs. So my work up until, I would say, about 10 or 11 years ago in my practice, it was all about periodontal surgery, implants. I had started to do something known as all-on-4, which is full mouth rehabilitation with implants. So that was my bread and butter. I used to um, teach. Later on, I used to lecture on those things. I did some research on several aspects of that. And I used to work fewer days. I used to work shorter days, and I used to work to make more money.
Yeah.
But about 11 years ago or so, my good friend Dr. Kevin Boyd is the one that introduced me to all this. And Boyd, of course, he's a very well-known pediatric dentist. Actually, I've known Dr. Boyd for a lot longer than 11 years ago because we met through a special needs when I was taking care of special needs kids. We met through a mutual patient who was a special need, and it was also a friend of my family. And that's how we met. I said I needed to do some things, and Dr. Boyd needed to do some things. And I said, if we can collaborate, and that's how our whole thing started, is maybe we can do it at the same time when that child is, under general anesthesia. And that's how we started. And after that, we met several times over treating special needs kids. And about 11 years ago or so, I think it was 2013, um, and we were working on a special needs 5-year-old. And Kevin Boyd said to me, and I hadn't seen him for probably over a year or two, because we hadn't gotten together to work on anyone. And he said, "Can you please release his tongue?" And I go, "I'm sorry." He said, "Milt, can you just release his tongue?" I go, "I don't know. I will try. I mean, I've done it before, but I don't know why you want it, but it doesn't even look very tight, but okay." So I did. And then afterwards, he said, let's talk about it. And he's the one that introduced me to, at the time, he was involved with studies that started at Stanford and then came to Children's, which, by the way, Children's Sleep Center in Chicago at Lurie's is the biggest, as far as I know, children's sleep center in the country. And the director there, Dr. Stephen Sheldon, who's a pulmonologist, sleep medicine physician for kids that I've known, and in a couple of occasions I've lectured with him. He's the one that uh, talked about or collaborated with Kevin Boyd. And there was a little movie that he showed me at that meeting called Finding Connor Digan. I don't know if you've watched it, Neil, or if the people listen to it, but I think you should. You should go on YouTube and look at it. That was a teenager or an early teenager that had a lot of ADHD-like and behavioral issues and learning issues and everything else. And he was one of the patients that I had nothing to do with, but Dr. Boyd and the people at Lurie's and so on and so forth, they were able to, with expansion and other things, to open up his airway and change his life. And it's funny that we're talking about this right now because a few days ago, Dr.
Hmm.
Boyd sent out an email to some of us that we collaborate with, and on his, including Joy Miller, and on that email, he shared the fact that his mother just reached out to him to send him a picture of this person that now is a young adult and their family, and thanking Dr. Boyd again after these many years of changing all their lives, including, of
Wow.
course, their sons, but himself. So it's a good coincidence. So anyhow, then I started reading some of the studies. He had written a chapter about ADHD and the fact that it's not just about that it's a bunch of symptoms. And that's what Stephen Sheldon says. And that's what got me interested in this. He said, a bunch of symptoms do not make a disease or a syndrome. These
Yeah.
kids, they merely are trying to stay awake. And that was a very profound statement. And, because we're kind of thinking the opposite, right? That those kids that they do have ADHD that affects the brain, that you can lose up to 15 IQ points, that affects behavior, that it was the ADHD that affects sleep. But now they were looking at it in a different way, where airway, open mouth breathing, snoring, sleep disordered breathing, even sleep apnea, that affect quality of sleep, they actually affect or might be the main cause of the behavioral issues that we're seeing, during the day for those children. And this is what blew me away because I had no idea about it. So of course I asked him, "What do you need me for?" He says, "Well, part of this is also tongue ties, or lip ties, but especially tongue ties. If a child is tongue tied and the tongue stays low and back and blocks the airway, especially when they lay down, if we release the tongue, besides other issues they might have, it might improve their airway because it might be, he considers the tongue part of the respiratory system as well. So it's not only about speech and everything else. It may affect the way you breathe depending on what is the tongue posture, which I learned from people like you, Neil, because I didn't know anything about. I didn't even know what tongue posture was, except when I was talking to therapists and some people like yourself, or PTs or OTs, that I learned about this. That the actual resting position of the tongue is on the roof of the mouth. Who would have ever thought? We are not really taught any of this or
Yeah.
any function. And about fascia and
Hmm.
how, forget about how the tongue tie affects anything. In medical school and dental school to this day, the only thing we heard about fascia is all that white stuff underneath your skin that covers everything. And
Yeah.
that is the end of the lecture. So there we never was talked about function, about problems with that, and now I know better. We were taught, and I think we're still taught, not to believe in chiropractors. Uh, the only people that we should believe in is PTs, but we don't really need them for anything, except unless you're an orthopedic surgeon or something. I mean, there is a very big disconnect between therapy and therapists and doctors, especially surgeons, because most of the surgeons that I've talked to and now that I collaborate with, initially ENTs and everything else, they didn't think of anything had to do with therapy or any of that stuff, except if there were some severe speech problems, and then they will maybe refer or tell the parent, go and see a speech language pathologist. That's about it. None of anything of what we do. So anyhow, that's how I started. And of course, I'm a scientist. And in order for me to start doing a procedure like anything else in life, I have to see the evidence, right? A lot of our colleagues ask, okay, where's the evidence? Where's the evidence? And I'm not talking about just studies, and there are studies. It was more evidence. Okay, let me see what's going on. What are we talking about? So I went to my first meeting in Montreal. It was the IATP that I didn't even know that existed. I asked Kevin Boyd, what is IATP? Because he was the feature speaker in
Mm.
Canada on the international meeting. He says it's the international tongue tie affiliation or whatever, affiliate profession. I go, there is a tongue tie organization? He says, oh yeah. That was before ICAP, was formed. And I
Yeah.
said, oh my God, I go, tell these people to go get a life. I mean, if they get a whole organization about tongue ties, that's how little I knew. And then I went to that meeting, and it was mind blowing, because I'm, as a surgeon, used to go to meetings like for bone growth and jaw surgeries and implants and all the stuff that I did a lot of. Now my practice is about 20% on that, because I cannot lose my skill, and
Hmm.
that's fun for me to do.
Yeah.
But 80% of my practice, I gave that stuff for 80% of my practice in order to do all ages of tongue ties and lip ties. And
Yeah.
what I say that is, when my patients come and see me, from infants to adults, right? We do a full evaluation. I collaborate with therapists and other specialists. It's not just releasing a tongue or a
Yeah.
lip or anything like that. It's way bigger than that. And anybody who thinks that they can just see a child or an infant or anybody and just release their tongue without considering anything else, to me, is not right. It's not
Yeah.
right, because you can make people worse instead of
Yeah.
better if you don't consider everything.
Yeah.
So then I met a lot of people there, and I went and spent time with, first it was Dr. Larry Kotlow. I think everybody that has anything to do or heard about tongue ties, they know Larry. He was very kind to have me, and I spent almost a week with him in Albany, New York. And then I met Dr. Ghaheri, Bobby Ghaheri, who's probably the most well-known ENT that deals with those kind of things, especially in
Yeah.
implants. I'm still collaborating with him. I went and visited him back in, I think it was 2014 or 2014 probably, or 2015. And we've been collaborating since, because he's an amazing man. And
Yeah.
it's funny, because when I was leaving his office, his clinic, he said, Milt, are you sure you want to do this and get involved with this? And I thought that I did something wrong. I said,
Yeah.
Bobby, I'm sorry. Did I offend you in any way? You think I shouldn't be doing it? Did I say the wrong thing? He says, no, 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 no. He says, but if you start doing this, it will take over your practice.
Yeah.
Are you
Yeah.
willing to give up a big chunk of your practice in order to do this? And he says,
Yeah.
Seems like you have the passion, but I'm telling you right now, it will change everything. And don't start and stop. I recommend that you think through this and decide, is this what you really want to do? As a surgeon, are you willing to give up things that you're doing right now that you love in order to do this? So
Yeah.
then after that, I changed lasers, and you can interrupt me anytime
No,
because
let me say no. This
yeah,
is too good. This is too good, and I want you to continue. But I want to just throw in one thing, and that's um, because I'm really eager for you to share what led you to and who led you to, because I think you've given such honor and respect to other people, and I've seen that because I've heard you share in some places, or I've talked to you. But I'm really excited because you are such a role model and an inspiration to many. I know, and then I know your many look to you, and especially you'll be sharing at the Breathe and Thrive Symposium, the Laser Study Club there in Florida with Peter Vitrick and the others. And I just know people are going to be like really in awe of your dedication, because I know what you make it about. You make it about the person and the patients and the families. And because you see babies to adults like me, that's why I feel very so resonant with when you talk and what you explain. I see babies to adults, and I had to make the same decision. It's not the same decision, but several years ago, I kept saying, I'm seeing all these people, but it's really the airway and feeding and, the speech and digestion and respiratory. Those are the people that need me the most, because nobody does what I do. So I decided to narrow my practice and keep, like you said, keep like 20%, keep something. But then I said, I need to prioritize getting babies, getting pregnant moms, postpartum moms, so that they have priority over our schedule, so that no matter what, if they need it, they can come in. So we blocked out time, and only on the week of would we give out those other times if they didn't need it, because otherwise I was never getting to them. And I thought, no, they're the ones that are in need. So they have the most access to my schedule. But I just wanted to say that healing takes a village, and that's really what I love to share on my podcast, because I want people like you who know what a village is. You know what a family unit is. It's not just a mom and a baby, or a mom, dad, and a baby. It's the caretakers and you become like you, Dr. Mill, having so families. I can see this. You become part of their village. I see this in their comments, and they refer to you as the person who guided them when they didn't know what to do. And not only did you guide them, you said you don't make it about you. You said, yeah, and you need this person for, Cairo and PT and OT and lactation. You're so quick to, because you know what it's like to, what people really need. You're so quick to say you need this and you need that, and because you know that this is a complicated thing. It could be beautiful, and you've seen many people helped. So I just wanted to interject and say that Dr. Ghaheri as well, like he was pretty pivotal in me, but it was mostly through people I knew sharing his resources, saying you need to read his article to help you know what to do with your baby, because my baby was born with a tongue tie 8.5 years ago. But since then we've talked and connected, and he's been a great inspiration. So I want to throw it back to you and say, continue on sharing your story. But I just wanted to say that to like all the families out there. A lot of people are listening that have kids, and they're not necessarily practitioners, but they can see that coming through you, that you're like, your heart is to care for people, and what that looks like is a lot when they need all these solutions. So yeah, go ahead. Microphone is back to you.
thank you. And like I said, you can stop me anytime and make a comment.
Yeah, great.
Um, and I totally agree with what you're saying. And I see that because a lot of times, especially on children, that are longer consultations, right? And we never do same day on children by any means, shape, or form. They need so much more depending on where they're coming from, right? And how
Right.
much they know about this. So
Yeah.
a lot of times on my consults, I spend 95% of the time talking about everything else but ties. And
Mm,
then we're going to talk about the ties, and we'll take pictures and explain about the ties the last maybe 5 minutes. But the
yeah.
majority of thing is looking at a scan, because anybody over the age of 3, and we can talk about if there's any concerns of people about radiation and things like
Right.
that. It's very
Yeah.
minimal the way we
Yeah.
do it now, digital. And explaining the airway, nasal airway, and the oropharyngeal airway, behind the tongue and everything else, and sleep. And you see, a lot of times parents come to me because I'm famous about ties.
Yeah.
But most of the time, we don't spend talking about ties. We're spending talking about what is going on with their child, what is the situation, and the same thing with adults and similarly, with infants, of what are the issues, what are the problems, and then how does all this come together, and what is it that they need maybe before the ties are released. And that's some of the things we're going to talk about as we move on through this. So anyhow, so then I was using a specific laser that Bobby Ghaheri was using and Larry Kotlow at the time. I started with a 1064 diode, but then I went to Tufts. They used to have a course that I found out about tongue ties that I didn't know about, and it was Martin Kaplan.
Oh yeah.
In that course, and that's where I met him. And that was the first time I came to see CO2 laser, except the one that Larry Kotlow introduced me to, which was the Solea, but there was another one, Light Scalpel. I'm sorry, I mentioned names, but this is not advertisement. This is what I
Sure.
use.
Sure.
So in any case, and then I said, okay, maybe that's what I should be using, because I had experience with the original CO2, because Northwestern was the premier place where some of the studies early on were done on CO2 lasers. And as a resident
Okay.
there, I actually used some of the previous models, before Peter, before anybody else. My mentor there on periodontal surgery, as well as lasers, with Dr. Bob Peak. And Dr. Bob Peak is probably the first person that really used lasers in dentistry, wrote the book about it. I'm still talking and collaborating with him. He's an amazing person. So anyhow, so I got involved with that. And that led me to, because anytime I use something or I change something, I want to know who's the one that uses the most, who's the one that is best at it, who's been doing this for a long time. You don't just get something or buy something and start. You got to know, besides the literature, besides anything else, you want to know who are the people. And I always reach out to these people, and everybody has been amazing. That's how you meet people, that they're going to guide you through, and they see your passion. And that's how I met Scott Siegel. And Scott Siegel is an MD, oral surgeon. He was dentist, oral surgeon, and MD. He's one of the pioneers of those procedures in New York. And he is one of the most amazing, kindest people I have ever met in my life. And if you know and you meet surgeons, especially oral surgeons, they do have a high opinion of themselves. Scott is not one of them. And it's sad, I have to bring it up, the New York articles about dentists and doing all these bad things to babies. It's sad, not only because it's untrue. Now, I have to say a disclaimer that there might be a couple of our colleagues, it's unfortunate, but every profession has a few that are not doing the right thing. So there are some of our colleagues, thank goodness, very few, that are doing releases without concern for anything that we're talking about. And to me, that is unethical, because in our practice, we should always practice with two things: ethics and excellence. This is it. Ethics, don't do something to somebody that you wouldn't do to your own family. And excellence, you have to keep learning, and you have to try to be the best in anything you want to do. Not only, to the best of your abilities, and see and updating all the time. So this is Scott Siegel, and featuring him on that article, they lied to him. New York Times lied. They told him that they're going in because he's famous, he's doing all these things, got over 1,000 five-star reviews on Google, and he opened the door for them. They went, they saw him, there were lactations there. He talked about the literature, he talked about studies, he was involved. They saw babies going from not feeding back to breastfeeding, and then they came out and they left, and they wrote an article about how he's doing it for money. This is the unethical thing.
Yeah, that is.
Newspaper, the only reason he did it, he was not fame for himself, because I know the man, and I've talked to him and I collaborate with him all the time. They just lied to him because they had their own agenda. It is sad, but we have to deal with things like that. And he's a strong man. He's as famous as ever. So he does the right thing. So then I spent time with him and under his guidance, especially on infants. And then I was doing, as a surgeon, like I said, kids and adults, but especially on adults. I came to the point where I could release a tongue with a laser and everything else, but there were a lot of people I could not get a full release. I just couldn't. There was muscle, there was deeper fascia. I could see it, but I didn't know what to do with it. And again, by taking a lot of continuing education, sometimes you hit something that, opens, it has that light bulb above your head that you might get once in a lifetime if you're lucky. And I was actually at a course that Joy Muller and, their group, they put together in Los Angeles. And I was there, and for the first time, I saw this young ENT, Soroush Zaghi, that was talking
Yeah.
about his first 50 cases of functional lingual frenuloplasty, and I lost it. I lost it because, you know, I looked at this and I go, this is what I need. This is what I'm missing, that I couldn't figure out what to do. And the rest is history. I approached him. He invited me in his first course. I pretty much forced him to form a residency. So I convinced him to come down to California. I got a California license. Um, I spent time shadowing him in his office, in the hospital. I did cases, under his guidance at his office, and he pretty much guided and still is my practice, especially on children and adults. And I will forever be grateful to him and for the support, but also all the research, all the
Hmm.
support, having an ENT that is brilliant as him to actually dedicate himself to something like this and other things that he does, but especially to something that is a small part, like a tongue tie or something like that, and help us and take, he's kind of the target of the arrows from everybody that is against it, especially in the medical profession.
Yeah.
Same thing like Bobby Ghaheri does, especially for infants.
Yeah.
And
Yeah.
we wouldn't be able to be where we are today, Neil, without people like Soroush Zaghi, Bobby Ghaheri, Scott, and everybody that I mentioned. But especially, Bobby Ghaheri and Soroush Zaghi when it comes to this. It's amazing. I am honored to even know those people and collaborate with them and have them guide me, because this is what changed my life in my practice. And like I said before, I made more money before. I was very satisfied. My patients liked me, and everything else, because I do and I treat people like my family. But the satisfaction that I get from these families and what I do now is off the charts. You cannot buy this. You cannot purchase this anywhere. Those feelings and that. And here we are. I met you. The people that I have met when it comes to Airway and things like that, they are the most amazing people I've ever met in my life. I have never met so many professionals, medical, dental, therapists, chiropractors, that care so much about people that I ever thought possible. So thank you for doing this, not the podcast. Thank you for doing what you do,
Yeah.
helping people, because that's our purpose. That's what we're meant to do.
No, it's an honor. It's an honor, and I mean that in in multiple ways. It's an honor to, first of all, um, like you said, the people who have gone before us. I have all of you that you mentioned to thank, and more, because I kind of got into the field in 2016. Been a chiropractor for 8 years before that, but my daughter being born, that's what got me into the field. So Serenity, she's my biggest teacher, because she taught me as an infant who needed help what I couldn't do. And I needed to seek out, well, I mentioned Shervin Yazdi, Dr. Yazdi in Castro Valley. He's phenomenal pediatric dentist who was a few hours away that we could take our baby to. And I would have gone up to Dr. Ghaheri, but we had Dr. Yazdi. So, but people like you, people like, Dr. Zaghi, and who I've been, had the fortune of knowing for the past several years, and collaborating with, especially in the Bay Area. And then now, as I'm here in Santa Barbara, but was in LA for a few days, and I will be down here permanently soon. So it's quite an amazing thing to see, the dedication, and spending any time with any of you, which I'll mention that has been just, you feel when somebody cares, and when somebody has cared for a long time. When I was sitting there at the at the place near the WDDS, the World Dentofacial Sleep Society Congress there in San Francisco, where I met you there just recently here in November. And I sat there with you and Kevin Boyd one night after the Stanford kind of experience, where we got to go tour it, and just see what Audrey Yoon and Stanley Liu have done to help the field. But in that moment when I was sitting there with you and Kevin, I thought, I'm with two men who have two great men who have cared for many people, and you have seen many people go through great pain and great joy, because thankfully they've been able to find some solace, some help, and that, I think, is what is the greatest field or body of research is that you have people who care. And that being said, we have people like Soroush, who has exhaustively gone through and intended towards compiling a body of evidence, and many others too, that are showing time and time again. Oh, I wanted to kind of mention that with he's one of them that as well, just like you mentioned with Scott Siegel, who sat down and he spent hours talking to the New York Times, and they distorted everything. And I know another lactation consultant, Melanie, and I've talked to her many times since that article. And anyways, and I don't want to belabor that part, but I want to stick to the good that we've seen, that the fires that are lit under us who care for people in this field. And then, I wanted to go back to something you said, and it's really important, because I think that, if we don't talk about this, then people will just think, you just did this thing and you came out to California. Your dedication to your patients and to your own, even though you were very experienced in a lot of things, the reason you got a license in a different state, which is no easy task, was because you
Especially
wanted to come,
California.
especially California, because you wanted to get on an airplane, fly from Illinois. By the way, that's where I was born and raised. Not only, just an hour-ish from where you are, is where I was born and raised. And I, went to undergrad near Northwestern Benedictine University. And my degree's in molecular biology, by the way. I'm a molecular biology grad. So I know what you talk about when you talk about immunology, interleukins, and I was studying some, but anyways, with talking about your dedication, you flew from Illinois to California, not just for a little course, you got a license here. So how many months did that take? I just really want to ask you.
I went back and forth several times over a year.
Oh my gosh, that's amazing. Like that's wild. So, and of course, that was what you did because you knew you wanted to arrive at a refinement of something that would help so many people. Nobody was asking you to do that. Nobody said, "Hey, Dr. Milt, would you hop on an airplane and go learn from Soroush?" Nobody knew that. They counted you as the person who they knew to help them. So I just want to know, like, what was that one moment? Like, if you could go back in time to that one moment where you're like, I got to do this. I gotta start. I gotta get there. Like, when that happened, do you remember where you were? It's okay if you don't. What is it? What was it like
Well,
to feel
it's
that
not.
fire?
It's more of a philosophy that I've used throughout everything that I've done in my practice. Okay,
Yeah.
that's what I was saying up before about ethics and excellence. The
Yeah.
excellence part comes if you do anything in any field, you want to do not only at the top of your ability, but as great as it can ever be.
Mhm.
So, in order to do that, you have to identify the people that can guide you there. Some of those
Yeah.
things we develop ourselves or whatever, but a lot of those things, there's been pioneers that they've been doing this, and you seek them out. That's what I said when I first saw Dr. Zaghi talk, and
Yeah.
I went up to him and I said, Dr. Zaghi, I'm Milt Geivelis, but whatever, and I said, I love what you said. I said, can I come? Can I shadow? And he says, Milt, I'm not ready yet.
Mm.
These are my first 50 cases. I'm still figuring it out.
Yeah.
So I said, well, would you put up a course? Would you do? He says, I'll call you. That's exactly what he said. I'll let you know.
Yeah.
And for me at the time, I thought it was like, all right, he's just kind and says, all right, whatever. I don't care to talk to you, but I'll call. But he actually did. And
Yeah.
I took, his first course that was one day, and he showed a couple of live surgeries. And I asked him, I said, before I come to the course, can I come and shadow? He said, well, I haven't done that, but okay. So I went and shadowed him and asked him questions, and then I took the course. And then when the course was over after one day, and it was only, I think, 16 of us, and everybody's leaving, he comes over and he says, well, what do you think? I said, this is the most amazing thing I've ever seen. And I'm very honest. And I said, can I do a residency with you? He said, I'm sorry. I said, can I do a residency? He says, I'll call you. The same thing. And that's how it all
Yeah.
started. So,
Yeah.
and you want to do, what I do is not a job. I
Yeah.
don't go to work every morning and go, oh my God, I got another. Now I work a lot, because by choice, but I just love what I do, and love helping people. And I never look at the bottom line as the money. Money will come. You have to get paid for what you do. Well,
Yeah.
not every time, because we do things that we don't get paid for, and that is because we gotta help whoever we can. And sometimes we're not gonna turn away somebody because, oh my God, you can't afford anything. But for the most part, we make enough to pay our expenses, raise our families, and that's all that matters.
Yeah.
Uh, and my ethics came really from my father. I lost my dad very
Mm,
early in life because he got cancer and died very early. But since I was a little kid, he treated me like an adult. In one of our talks that we had, he said, I was, Neil, I was probably 6 or 6.5
mm,
because I was in first grade. And my dad worked 2 jobs so my mom can stay home and raise us. So I didn't see the man very much. I didn't come to my little soccer games or whatever it is, or school plays. But he was there occasionally on a Sunday if he wasn't working, and we have dinner in the morning. We'll talk, and he says, "Milt, when you're on your deathbed, here I'm 6.5, and my dad is talking about my deathbed. Are you kidding
wow.
me?"
Yeah.
He says, "When you're on your deathbed and you look back, he says, if you left this world a little bit better than you found it, you had a life worth living." He
Mm,
said, "I don't care how successful you are, or I don't care how much money you made. If you had to step on people's necks to get where you were, you might as well have never lived."
mm,
So that's my motto.
yeah.
Leave this world a
Um,
little better than you found it,
yeah.
and
Well,
then
that's
you're done.
no, that's really powerful, and yeah, I can tell. That's just as you mentioned that's the respect for your dad, and what he shared with you was something that, like, you've never forgotten that, and I can just see like how that's motivating to do something more than just a job. It's not, yeah, from nobody will question that. Your passion, dedication, it comes from a lot of places, and to have it come from that kind of early moment, 6 years old, that's pretty profound. And now you're 34 years old now, so that's been like 20.
Yeah, right.
But no, not to throw light on that, or make it too light, but yeah, and it's really so compelling when you think about, what do people go through in their early life that leads them to do what they do now, and many can say that, there are things in their lives that prevented them from doing something, and but with you, it's like that was a, catalytic moment. And yeah, so I want to jump back in and say, well, where you've come today is, we got in the timeline, we got to, what year was that you came to California?
I
In
believe it was from 2018 through 2019.
Yeah, okay.
Yeah,
Yeah. Here, let me fast forward only to do this, and then
yeah,
you can come back and fill in whatever you want. But and we've known each other for some time now. It's been recent, yet doesn't feel that way. It just I oh actually no, here's what I want to mention. I emailed you and you got back to me, which was amazing. I emailed you. It was several years ago, and I was in California, in Redding, where we have lived, and I was just looking for somebody to, kind of like help me, because I was learning the 1064 nanometer laser approach, baby lace, or LAFTR. Actually, I learned LAFTR with Amy Ludman, who learned from Derek Nordstrom and was sanctioned to teach it. But it's this amazing, modality to help, holistically help, and I think it's a great adjunct to frenectomies and frenuloplasties. But that's not about this. But I reached out and I was trying to find, because originally I was trying to train with a certain organization that required a dentist to go with me. So I shot you an email and I'm like, hey, anyway, you could take the class with me. And you were busy with your practice, and you actually said, hey, that's strange that they require you to, no, many are doing this like yourself, many chiropractors. But I just wanted to like say that it was great. It was a great encouragement, even though we only had a few back and forths. And then it was a couple of years later, maybe 2 years later, like, where we really connected, and then shared a case, and then these things were really wonderful. So, but I wanted to make sure I like shared what we've talked for a while about doing a podcast. But I read one of your posts recently on Facebook, and I'm saying I've been looking at your stuff, and I'm like, you have so much going on. And when I saw you write something, I'm like, oh, he took time to get on Facebook and to write a post this is really important because I always look for things from you, and you have so much that it's not like you can get on there and share all the time. You wrote this post about your upcoming, presentation that you'll be doing at the Breathe and Thrive Symposium in Florida, end of this month. So it's like January, 31st to February. The only reason I'm not presenting there is because we're moving that weekend, and I knew that, so I couldn't go. But it's okay. I'll miss you guys.
Change your moving.
Is that so? Like, so you wrote this post, and I saw the just a very, very, very deep conviction coming through. I'm going to read a little bit from it just because it was a really good post, but I want you to go into more about this. But of course, this is about you mentioned Dr. Ghaheri being a mentor to all of us because he'll be presenting there, and you said this is not just about TOTs, tethered oral tissues. For those who most of us know what that is. Our Chicago group will present on collaboration with pediatric ENTs, sleep physicians, early ortho providers, and therapists for best treatment outcomes for children, and on how to collaborate. And of course, you mentioned some of the AAP getting more vocal. So, but I want to focus on the fact that I look at this and I'm like, oh yeah, I see what you wrote. But when I saw it originally, I saw this like call to action. It's like, look out, everybody. We're going to come with some stuff, and we're going to really share the nitty gritty of what this is. And I think it's going to be great information, but I'll just share. I think, and not, maybe I'll say not even more importantly than the info you share, because it'll be valuable, is the dedication that comes through that and the commitment to care for these people. So yeah, I just want you to share just a little bit about like what provoked you to present there. Like, yeah, what provoked you to present there at this time? Tell me about that.
Great question. The the whole thing is like we talked in the beginning, is especially when it comes babies too, but especially on kids, on children. I spend more time explaining to the parents because they come to me from all different areas, right? Not only areas around the country. It's more about, there might be parents that come to me because I saw a relative. So they know nothing about it. All they know is the relative said, we saw Dr. G and he did this and that or whatever. He guided us and now we're better or whatever it is. So they don't have much knowledge of anything, not about Airway. So they're coming for me to check for a tongue tie and see if, that affects their child. They know that their child has problems, either behavior or sleep or speech or anything. There are other parents that they are very well versed, right? Because they've seen, let's say, somebody like Dr. Boyd, they've seen the therapist, they've seen a chiropractor. And everybody says, okay, go and see Milton, see about that. So they come with all different types of levels of knowledge. My job is to put everything together. But for a lot of my patients, I play the quarterback. Means if they come to me and they don't know anything about anything else, or a lot of those people, I'm the one that will take the scan, will look at the scan, do a preliminary, evaluation. We look at symptoms, we take full history, we talk to the parent, we talk to the kid. Very important to talk to the child. Children, a lot of times some of my colleagues, because I've been with others too, is they talk to the parents, but they don't consider the child. So the child is sitting there playing on the parent's phone, and they're completely disengaged with any of that. You need to address that child. And then you'll see, some of them, they might ignore you or whatever. That's okay. I try to get their attention. And Neil, if you told me 12 years ago that I became a periodontal surgeon because I didn't really care to see a child in my entire life for practice, I wanted to see adults. But after these, everything has changed. I learned techniques from people like Dr. Boyd or others, pediatric dentists or dentists that are really good with kids on how to handle kids. And then you develop your own thing. So that is all very important. So then since I'm the collaborative person and I know that they need other things, I had to create that group of collaborating professionals. It started with therapists first. When I first started doing this, there were therapists that I didn't know they existed. There were a couple of them. And then a lot of the therapists that I work with, and I believe that in the Chicagoland area, we probably have the biggest group of collaborating healthcare professionals in the country, at least as far as I know, and I've been told. So you start, and then a lot of those therapists I met because of their kids or their babies, and they were speech language pathologists. Some of them, they were kind of nibbling on my functional therapy. Some of them, they had already been on the way to certification. Some of them knew nothing about it. And I kind of drew them in and I go, okay, see what is going on. We need people like you. There's a lot of speech language pathologists, but not my function, no people that understand airway and all those other things. They actually slowly led me to chiropractors. And some of them that are treating infants, or pediatric chiropractors, or chiropractors that do with neurological issues. And for the first time in my life, I understood that the chiropractor knows more about the nervous system than any medical professional besides a neurologist. It's pretty amazing. So anyhow, so that's how this whole thing started. The hardest ones to collaborate with because of what I do, and especially when my name came out that I'm doing tongue ties and lip ties, it was a lot of the pediatricians and the pediatric ENTs especially. Now the thing is, we need those people, right? We need to collaborate with them. Now, we can ignore them sometimes if they're against everything or they have a poor attitude. But I have to tell you that a lot of us that are involved in ties and everything, we talk bad about the pediatric ENTs, about the pediatricians. You have to understand where they're coming from, right? Most of these people, they do like kids. That's why they went into pediatrics. It's just that their own organization, even on the latest paper that came out, especially on infants, on kids, they don't push back a lot. It's more mainly on infants, but they tell them that, tongue ties don't affect anything. They don't exist. They don't. We are not taught to collaborate with chiropractors. We were told if you fall off the face of the earth, we're going to be better off. Okay, this is our education. So anyhow, so to approach them, I had to find ways to approach them because I want to collaborate with them. I don't want their referrals. I want them to help me with what these kids need without telling parents that what I do is nothing. It shouldn't be happening, that tongue ties don't exist, that they shouldn't see me when they go to see them for their tonsils or adenoids. Even further than that, because of the type of procedures that I do, which are frenuloplasties, and they're lengthier procedure on those kids and deeper releases, a lot of times those little ones or special needs, they have to be put under deep sedation. And if they need another, for example, adenoid reduction or ear tubes placed or something like that by a pediatric ENT, if I could collaborate with that pediatric ENT, that I can bring them to the point where they can respect what I do and where I'm coming from. And you have to gain their respect. And you gain their respect by not concerned only about the ties, but about the health and the patient-centered approach. Because then they start looking at you in a different way. And of course, the fact that I'm a surgeon and I'm on staff at Northwestern Medicine Surgical Department, it did help. When I approached them.
Yeah, absolutely.
But you have to be polite, you have to be kind, you have to be unselfish, and you have to tell them why what you do and what you identify in the office is good for them and their practice, and they are helping the kids. Because a lot of times we are the first ones, especially general dentists that deal with kids or pediatric dentists, but myself now as part of that group, we are the first ones to identify those problems. And we're the quarterback that is going to send them. I have seen tons of babies with respiratory issues that the pediatrician, kind of downplayed, or they see him or whatever. And I refer them to the, through with the consent of the pediatrician to a pediatric ENT, preferably one that I know and I work with. But I refer them because they come to me for releases. But right now they got all these breathing issues that they need to be dealt with first, or at least evaluated before I touch their tongue or their lip or anything else. That's very, very, and the parents are so thankful. And there are times that they don't come back because some of the things resolve and everything is better. And they see the therapist that I send them, or the lactation too. And they go, oh my goodness, now they're breathing better. Now they're doing this. Now they're swallowing better. Now, I think they were bored. I don't think we need you yet. Let's do some therapy. So that's why I try to learn more now, not about the tongue ties, not that I don't learn more about tongue ties, but I spend a lot of continuing education learning about all these other things that I was not taught about. From airway, from early orthodontic treatment that I learned so much, to ENT issues, on kids, from um, breathing issues, functional issues, from babies to, I take lactation course. I'm not a lactation, but I want to know about it.
Yeah. Yeah.
I want to. So those are, and then suddenly your field opens up, and then I get people reaching out to me and going, I'm so and so, and I know about you, and I learned from my friend, like you reached out to me,
Hmm.
and those are people that have a passion. They don't reach out to me because they want something. It's just more like, I see those patients. I'm the therapist and I don't know what to do. And I want your guidance. And can I work with you? Or what did you recommend I do? Where do I get this knowledge? How do I start? I connect them with other therapists. I connect, you know what I mean? This is what expands this group. And so it's the most amazing thing. You
Yeah.
know,
I was.
we
Go ahead.
spend, including the ENTs that collaborate with us,
Yeah.
we spend a lot of times more time for things that we get zero money from,
Right.
by
Yeah.
doing all these things and guiding people and talking to them after hours and so on, and with therapists and everything else, than we do for getting paid.
Yeah.
And that's voluntary. That's
Right.
part of what we do.
Yeah. And I
What do
know
you do?
that's, yeah, and it's true. It's just there's too much. Yeah, so many places in there that I was saying yes, amen, and it's because, well, I'll hit up three things and then get back to you. But it's like patient centered care is really what guides it, because if you care about people, and I know that was your mention when you're saying how do you really like help this collaboration with pediatric ENTs that may not understand why you do what you do, because you care about the people, the patient. And if you can center around that, you can unify disparate fields. But then on the other side, there's those like lactation and SLPs and OTs and Kairos, like me, who we're like, this is what we do. We can't get enough of it because we know, like, how can we know what we need to know unless we combine our minds, and that's, I love that you have that perspective too. Even more recently, I got to meet, I was presenting to the AAOSH. It was Shirley Gukowski with Primal Air. And of course, she mentioned you in quick moments of saying like how much she's loved collaborating with you. So with her, her in that lactation myo kind of, so she's seeing people who from this perspective as well. It's like in her respective world, even though you two collaborate and she defers to you, in her world over there in Sun Prairie, she's kind of a quarterback as well. And it's like, we need these quarterbacks to get together. And you very much are that. And you very much are the one who will intake and see, and you care about people, and I mean patients, but you care about people more than, things like time and money. When you're like, you know what, you need me, but you actually need that person, and you'll put somebody towards a place that they need, because that resource is going to be more valuable in this time. And that takes a lot. And like you said, that you're just doing that beyond your hours. You're doing that, it's not your consultation. It's not that. It's so, I just want to speak to that part because it's really pivotal. And the patient-centered part, meaning like when you care about people, and actually, Shirley and I were talking about this because I talk a lot about the dyad, the triad. When you're caring for a family, it's so much about this dynamic balance and this interaction. Um, but when you're caring for a patient, it's like you don't just care for them, you care for the whole unit. So, do you mind if we just like go into when you're taking care of families? The dyad is such an important concept because there's no separation between mom and baby, right? And then in some of these families too, if mom and dad are there, that's one unit and baby, so that's a dyad or triad, if you will. And then if you have caregivers, nannies, grandparents, you extend that, and you like, what's it like to care for, you know 2 to 3 to 10 people when it's really one person who they're bringing in? Tell me just kind of
Yeah.
some any moments that stand out to you. I'd love to hear.
Well, the first thing is, when you treat a child, or especially a baby, you are not treating the baby, you're treating the parent.
Mhm.
Right?
Yeah.
They have to feel comfortable. They have, and I always tell them, there's no pressure of having anything done.
Mhm.
If they don't have at least a lactation there, if they don't have that village of people to help them out, a lot of
Mhm.
times I will not do the procedure. I might do only a consultation, although they might have come from a release, but they're not ready.
Yeah.
And I don't want to hand them back a baby and have them go home, although we saw them the stretches and what they need to do post-operatively, especially first-time parents, because here
Hmm.
they barely know how to change a diaper. And here
Yeah.
they are seeing me, and I'm going to give them all these things that they need to do. And they're not emotionally, I mean, they're not in the right place. So I
Yeah.
would have to refer them to somebody first and go, don't worry. Let's start with some therapy. Let's start with a lactation. Let's start, if they don't come from there, right? Because they've tried all
Right.
these things first.
Right. Right.
Let's do this. And then suddenly you see them how they calm down and they go, oh, okay. So he's not mad that we set up the time for him to do the releases. Because that's the other thing too. Sometimes
Yeah.
parents have come to me and I'm the second opinion. And they've
Yeah.
seen someone else, one of those few people that are not doing the right thing, in my opinion.
Hmm.
And they were really the person was upset because they had some reservations about doing the procedure, a bad vibe or something, and they became defensive or really mad at them that they had this time that they reserved for them and they decided not to have the release done. That is
Mm.
unethical. That, in my
Yeah.
opinion, should never happen. This
Yeah.
is, you are treating the parent really, and their emotions and everything else. And a lot of them come because they have at different ages and everything else from different backgrounds, but they've been told things by physicians, by pediatricians that don't know better, that are it's putting the blame on the parent, on the mom,
Yeah.
meaning your breasts are not this, your nipples are too long. Oh my God, the
Yeah.
things we have heard from them, and the mom gets depressed because the baby's not thriving, and they're being blamed because of themselves, their structure, their milk, to the point where, I mean, we've had people come, moms come in that they're saying that they need to use formula because their milk is non-caloric or not caloric enough. I've never heard that a mom can have skim milk coming out of her breast. I mean, it's ridiculous. Those are things that shouldn't be told because there's no side, there's nothing behind them. So you are treating the family. You're not treating that
Hmm.
baby because everybody needs to be involved. Sometimes, like you said, sometimes the mom might come with her mom.
Hmm.
Sometimes the mom might come with the mother-in-law,
Yeah.
right? And I know that, and of course I play the vibe. I gotta make him laugh. I gotta take some of that pressure off. I gotta
Yeah.
explain. They all know there is no pressure in doing anything. I would explain everything. I would explain that I recommend this because of these reasons, and then saying that I would never do something to your baby that I wouldn't do to my baby. My problem is that I didn't know. I would have done things to my kids when they were babies that I didn't do because I didn't know any better. But the decision is theirs. My thing is to educate them, to make a decision. But I said, if you're not 100% today, that's okay. Take your time. See the therapist again. Do whatever it is to bring you to that state that
Mm.
you might be a little
Yeah.
nervous, but I don't want you to have any second thoughts after the release. So I'll
Yeah.
tell you the bad, the ugly. I'll tell them I'm very transparent. You have to tell them, not that, oh, yes, and we're going to fix this and we're going to fix that. You don't know what you're going to fix.
Yeah.
Tell them what this might be a part of or a cause of. I can promise you that it's going to change everything. I'm
Mm.
hoping things are going to get better.
Yeah.
But this is what can also happen most of the times temporarily, right? That they might have some breast aversion or whatever. Usually, very rarely we see it if it's done
Yeah.
properly. They have the village, but they
Yeah.
need to know. So if something like that happens, they are not upset. It's not like they don't know what to do. They don't feel bad, and they
Right.
don't have a second thought that they shouldn't have done it, right?
Yeah.
So
Right.
it's what you said is probably the most important thing of how to get the family to understand this and to be a part of this, because they're the major people that are going to be doing all these things, especially on babies, but on kids too. And if
Yeah.
the dad is not in agreement, we got a problem.
Yeah. Right.
Okay.
Hmm. Hmm.
Somehow we have to figure it out,
Yeah. Hmm.
because it's not helpful when the mom does not have support from the dad in a situation like this. And that's one of the toughest things, but we
Yeah.
try to figure things out. Sometimes I talk to the dad after hours, or if they have questions, whatever it is, I try to explain the same thing
Yeah.
when I refer them for body work, pediatric chiropractor, and the dad says, I don't believe in chiropractors. I go, I didn't either. Let me explain to you how I came about to start working with them and what they do. No, they don't take babies and crack their necks. They're doing other things. And the people that I work with, these are the things that they do. It's up to you what you want to do, but let me explain how I got into this, because I was like you. I was a non-believer. I was trained like that. So, excellent point. This is the main point.
Yeah. And I think that's such a good thing you mentioned there. So it's hard when And I've had, like more, so let's just say there are times when there isn't agreement between the parents, and it's so hard on the one that's trying to advocate for getting this procedure or getting the care that they believe their kid needs, a baby or a child, because you can just see that there's but when there is that, and I've had people reach out and say, "Hey, this," even if somebody says, if there's a mom who's got a baby and that mom is like, got their mom visiting, or and so this is amazing because you have family around that helps in the village. But then you'd say they're concerned about this and they don't think that I should do this. What do you think? And I'll say, big question there. That's a good question. And I love it when that mom can bring the mom in, her mom. And when you have baby mom, grandma, in the room, because then you can get together and talk about it when possible over the phone or in a text. And I'm always
Right.
texting, families. And if the husband or, is having an issue and concern, I often ask him, like, what is there anything you experience? What's going on? Like, what's your concern? And we talk it through. And sometimes that's it. They just need somebody to take, like you, to take time. And that wins their hearts. And then the ones that it's a really tough because they've had an experience that may be negative, and I'll just say, I am so sorry if you've had a negative experience. What I want to ensure you is this is really about you. And if it's going to be very gentle and slow, and these movements I'll do with your baby or kid, like I don't need to do anything. I just want to, and I would love to help. And just know that, look, if you see this post that I've made, or often when the parents come in, um, and I can often at the end of the first visit, I will put on gloves and work intraorally on them, and I'll show them, here's what I'll do very gently, or that trapezius muscle there, and the mom or dad's like, oh yeah, my left side is always tight. I'm like, that's because of the tongue tie. So on your baby, almost always, 99 out of 100 times, the left trapezius is going to be tighter than the right. You've had that because you have a tie. And this is not about you, but just to let you know. And some of those moments are the most profound because it's not always we can do that, right? This is not reasonable all the time. But if I could work intraorally on the dad, and then all of a sudden, I had this one in the Bay Area where he just sat back and he's like, whoa, that just released fascia. He didn't say fascia, but that just released all the way down to my low back. My low back just loosened up, and he was already on board. But it
Right.
was like
Right.
nothing like somebody feeling it for themselves to
Excellent.
know. And I think that's what I really wanted to touch on here is that when you said we're not, when we care for a baby or a child, we're not just caring for them. We're not caring for them. We're taking care of the family. And then one step further here is like, often if that baby's got narrow arches, tongue tie, etc., you look at mom or dad, probably there. You look in the grandparents, and I've had the good fortune of seeing a great grandparent and all those generations in the room at the same time. And I say, oh yeah, it's on that side of the family. And if I can work at them all at once in 1 hour, hey, that's a victory. But I think we're also looking at a time where we're caring for a multi-generational airway issue that is complicated. So I think sometimes some of this resistance that people might feel is because, hey, they don't understand because maybe they never had anybody tell them that this kind of care was possible. I think some people might even feel like, a little bit like, I didn't get that, and why are we spending so much time on babies and kids? But I think most people really want the best for themselves, for their kids, whether we talk about pediatric ENTs or parents. It's
Right.
like most people want the best for people, so they're always trying to look out and be cautious, and I think it's wise to do that. So I really love that you defer to people with honor and respect and speak to them, whether it's a kid or whether it's an adult. I was going to say grown up because when you take care of kids, you just say grown up all the time. And you say it's that you care about people. So, and the other thing I wanted to mention, and I want to get back to you, is that, to your like dedication and the ones that you collaborate with, including Shirley. Well, Shirley and another one in her practice are flying out to Reading this month to come do my training in body work. But I've got some dental hygienists and Mayo's coming, and I just love that because I feel like if I'm just teaching chiropractors, I love them because that's who I am. But it's like, oh, we're missing. So I feel like uh, those like you have been some of my after Serenity, and she taught me so much. And all my mentors before that as chiropractors and osteopaths and PTs, and I've collaborated with so many that they are some of my best teachers, are dentists and surgeons, PTs and craniosacral therapists. And so I myself, I love combining so many systems in my interdisciplinary approach in my office to care for people, because I often say, when some people can't find the village, they're like, I can't go to 10 or 20 people. And I'll say, I am not any of those people, but for this moment, I can think like them. And I know that that's how you work too. I said, I'm going to think like an SLP, like an OT, like a lactation. I'm going to think like them for one moment. And first of all, I refer you to this person and I need you to go see that person. But if I'm thinking like that person, here's what I think they might say. Don't take my word for that. Just know that, consider that. So I know you're used to thinking like others, and that's empathy. You can't think like another person unless you put yourselves in their shoes, and that's empathy. And I feel like empathy is, let's just call it a boring name of bedside manner, but let's just call it what it is. Empathy and empathic intelligence. Like you just, I know you carry so much of that, and I know that's what you kind of motivates you. So um, kind of tell me, like, what's, in this kind of looking ahead, and I know I have so much more we want to talk about. We're kind of coming to near the end, and you
Yeah,
can let
because
me
I gotta
know.
get to the office too. It's not only you.
Okay, okay,
No problem.
so
But go ahead and finish your. Yes.
I'll finish what I'm saying, and then I want you to cover anything that you feel like was,
Yeah.
burning in your heart to share, like your heart, not anything that we might have talked about. What else do you want to share? What are you provoked to share? I definitely want to make sure that we get, every bit of wisdom out of you possible in this time.
One of the things I gotta mention, and you know that you reached out to her, Dr. Kelly Wells, who's actually a chiropractor, craniopath, that she does craniopathy. And besides you down there, I mean, I don't know anybody else. I do craniopathy guided releases. That's for older kids and adults. And the way we do it is they have some sessions before. Dr. Wells comes to my office, usually on a Friday that she's not in her practice, when we're treating, and the patient comes about 15 or 20 minutes before. They have a craniofacial release. Then she's in the operating room when I'm working on that, because usually those are awake, although sometimes she works on kids that they are asleep, and we have the anesthesia team that they comes once or twice a month, and we do that, and she can still do body work, although they're asleep. But the most amazing thing for me, unless you see it, you will never believe it, is that I would start my release, and they gotta be super prepared with my functional therapy and everything. And then when I think I found in the safe area, the ties and everything and fascia, then I stop. And then she comes back and does another 5, 7, 10 minutes manipulation. And then I sit back down and I see tissues rearranging. I have seen things that come forward that were not there before, or part of the tie or tight fascia within the muscle fibers that I didn't even know it existed. And then, of course, sometimes we got to do it twice. So the results that we get, I mean, it's pretty amazing when you get all these professionals that understand the different parts of this, like you said, and how the tie might affect your body. And the more of these professionals, and we are all keep learning, right? Talk about Shirley. Shirley, we're going to have actually a seminar that we're going to be giving in May, and she's going to be a part of it again with our huge collaborative group. And it takes a lot to tell these people, to convince them, the pediatric ENT, or like Dr. Cote, who's coming at that meeting in Florida, right? The Laser Study Club. Those people have no financial interest in this. It's not about the ties, it's that collaboration that they want to talk about and say, okay, you're doing this, you are involved in this, but you have to do it the right way.
Yeah.
Don't take those kids, put them down, release their tongue, and you think you're giving them all these benefits. You need to consider all these other things, and you need to collaborate with some of us. So Dr. Cote used to be here, and she was part of the Advocate Network when I met her and I started working with her. And she's amazing, pediatric ENT, but her family, she's originally from Canada, from Quebec. And because she has two babies, and she doesn't want to give up practice, of course, she had to go back to Canada because her family is there and she can get help with raising her kids and everything at the same time, be able to practice. But she took time to really, it's so important of what we are doing and that's why the last 2 or 3 years, all I care to talk about is that collaboration,
Yeah.
Before I gave some lectures, what a great guy I am, what nice releases that I do, how I collaborate with the therapist and everything else. But this collaboration thing, instead of just, especially in kids uh, and adults, but especially in kids, is the most important thing. So now all I care to talk about is how we collaborate and then familiarize people what each one of us does,
Yeah.
including the sleep physician, including, everybody else. So
Yeah.
this is the thing I want to leave people is, in order to get these groups together, they have to value what you do. They have to understand that this is not about money. This is not about promoting a laser or myself, because that was the thing. I'm bringing them to something that is sponsored by a laser company, and I'm asking these people to come. And the last thing they want to do is just promote a laser company. However, the reason they are coming is because I told them there are a lot of laser companies. At least this laser company understands the value of what we do and how we practice. And they want the people that are going to be using their lasers to be aware of these and how to do this and how to collaborate and how to do the right thing. So they're
Yeah.
not there only to just sell a laser and have people work on a pig jaw and then go and start doing it. This is more about, okay, this is a group that we think is doing it right. Maybe you want to learn from them,
Yeah.
and maybe you can do the same thing in your town and how to approach these people and how to form your own village, and they're going to have your back.
Yeah.
When
Very
they
much.
go to a pediatric ENT that I know that works with me, and a mom goes there randomly and says, yes, and my child has a tongue tie and they're going to be see Dr. Geivelis, or they don't mention my name, and the pediatric ENT says, Dr. Wallner, where go, who's going to be, who are you going to be seeing? What about the tongue? Says, oh, Dr. Geivelis. Says, okay, you're good. I know Milt, he's great. He's going to do the right thing. We're good. Instead of somebody else, and they say, well, I'm not sure. Let me check or whatever. And they're a lot more aware. And now they are asking me and using therapists that it was unheard of for them before, because
Mm.
now they see the value and they see their own patients doing better when there is a therapist involved. And this is the biggest thing. We're not only changing, you know, us and whatever collab, we are changing some of our people in medicine that they would have never looked
Yeah.
at any of these or
Yeah.
collaborate with people like yourself or therapists besides speech. So that's the biggest thing. And that's my calling.
Yeah.
That's what I'm here to do. And that's why you're here talking about it today.
Yeah. Well,
So,
thank
you
you.
know,
Yeah, and just I'll give like a quick 1 minute, just a quick run through of how we even more connected recently on a case. I was on the Ben Greenfield podcast, and he's got this massive following, and he referred me to this family to do a remote consult because he had people reach out to him from all over the world. He was the top personal trainer in the world, top Spartan athlete in the world, and then now he is just a brilliant healer. But he mostly serves as a you know, troubleshooting, problem solving, thing for high performance athletes. But every once in a while, those athletes or those people reach out and they have a family member. In this case, this, this toddler was going through a lot of, sleep issues and things like that. And so he connected me saying, this guy knows about the cranials. So did a remote consult. And pretty quickly, I could tell and I could feel that the palatine bone was misaligned. And I said, I think that's your issue. So let me find out a little bit more. And that family, that they're from Illinois, right? So I'm doing this remote consult from my home in California to this family. And I find out that one, they had seen a therapist, but they didn't continue on. They had a release with you, and the release was really great. And you took care of a lot of their issues there. And you know what? So not only did I reach out to you, but I reached out to Joy Lance, who now is president of the IAOMT, myolactation, just brilliant person. And I asked her, hey, can you help me? I know there's some people in the area, but I want to find somebody really close to where they are. Well, I mean, of course she connected with me, Kelly. She's like, Kelly's the best person I know who can help with like the body work part. And I was so excited to get connected with Kelly, but it was like simultaneously you were telling me, Kelly, but in Kelly, amazing. I've had some conversations with her because mutually over this case we collaborated, and she even was just. I know that she's brilliant. She has myofunctional training on top of her craniopathy, and she was on a call I did with Samantha Weaver with AOMT, and I was sharing with their coffee clash in the morning about my floor of the mouth protocol and technique that I created, and Kelly was on, and she said, "Hi, it's Kelly," and then she ended up jumping into my floor of the mouth course. So love Kelly and all she's done with you, and it's such a good example of what collaboration can look like. But I want to share with like you and me emails on the phone. You didn't get paid for that. You were just taking time. And this case is years ago, like a couple of years ago, a year and a half ago. But you took time to email me, talk on the phone about this case so that I could feel more informed on how I could help this person, even though they were going to see the craniopath that you collaborate with. And that's your dedication. And I love that about you. And in this whole time, they ended up going to see Kelly, which was kind of it was part of this thing that they just didn't pursue at the time. But I was just the person to say in the end, oh yeah, go see Kelly. So it's crazy that somebody from California had somebody from Washington refer them to, and this is the way the world works. But I feel like when people care, these connections happen. And when you care about somebody, you will go out of your way to make these connections. And even though I know you were talking about professional collaboration, families need this curated experience. They need people like you to go out of your way to make connections because you care with others who care. Because then, you know what? Those families feel validated, heard, understood. And sometimes that's just as important, if not more, than the tongue tie release and the therapies. So, hands down, I commend you and I so appreciate you for all you do, for all you've done. I know we're wrapping up here. So, if you have anything else to say, interrupt me. But I just want to say to anybody, yeah, please just, Dr. Milt, Dr. Geivelis, he's speaking soon. But if those of you who aren't going to make it out there, stay tuned. I just think we're going to see a lot of really wonderful things happen from that symposium and beyond. I can't wait for people to listen to this. And so, I know you have a Facebook page, and just what's the best way people can find you if they want to find you and reach out and, seek your expertise, of course, with any of that. How can people reach you?
Just Google my name.
Okay.
Yeah,
Perfect.
you'll
Perfect.
get about my practice and everything else. Yes.
Yeah.
Um,
Milt,
and the reason I
MILT.
got a chance to talk to you, not now, but before, like I said, we connected, is because you took the time to reach out to me.
Mhm.
It's mutual. That's what collaboration is. I don't think you were getting paid when you send me an email and a second email, and then you called and I gave you my cell and we've been
Yeah.
texting. It's because of the same thing. You have the same values that I do, and that's why we're doing this. I mean, that's the whole point. It's the people that I collaborate with uh, are people that care, and it's way beyond what we get paid or not, or office hours. I would never thought that, like David Wallner, who's the pediatric ENT, one of the main ones that I collaborate with, who's the director of the Advocate Network here in Illinois, that I would text him at 11 o'clock at night and he would answer back about a
Right.
patient or
Yeah.
about a thing that we're going to do together. I mean, this is unheard of. This doesn't usually happen. So, but when people see, your values and you have similar values, it becomes a different thing. So, thank you for doing what you do. Thank you for all you do for families and patients and all ages. And that's what the future is. That's it, man. We try to learn more and be the best in what we do, and then collaborate with people with same values and same things. I always tell people, if you think you know enough to not learn anymore, that's when you retire.
Yeah. There you go.
And even then,
Mhm.
people retire
Yeah.
and still have a passion, are still learning, even if they're not
Mhm.
practicing.
Mhm.
So kudos to you and everything you do, and thank you.
Yeah, you're so welcome. And yeah, everybody, check out Milt's Facebook page and just look him up. And it's Milt's. Just those of you who are listening and you don't have your eyes on things, you'll see it. You'll see his info. I'll put it in the show notes and give people a way to just look you up and stay connected with you. And everybody just kind of stay tuned too. And we're gonna talk again. I can't wait. I feel like chapter 2, part 2. We did like 1/10 of what maybe 1/100th of what So I can't wait to talk to you again and catch up more and maybe share some things, reflections after you come back from maybe the symposium. So I'll be in touch about that. But thanks so much for sharing. And
Thank you.
yeah, everybody, listen up. Have a great day. Enjoy your day and stay tuned. In these conversations, we do deep dives, and resources are aplenty. So please tune in and enjoy. And I'm so excited to have you along for the journey.